Welcome to the office of Dr. Richard Levin and babiesbylevin.com. Dr. Richard Levin is America's first tubal microsurgeon and has been featured on Good Morning America, The Phil Donahue Show, People Magazine, ABC, CBS, and NBC nightly news programs, as well as other media from around the world. Patients travel from all over the United States and from every corner of the globe to seek his expertise. Dr. Levin offers one of the highest success rates for tubal ligation reversals at an affordable price. Join us to find out why so many women refer Dr. Levin to family and friends, and how he can help you achieve your dream of having a baby.
Let's talk for a moment about how you should get in touch with me. Most of you have been emailing back and forth with me, and that is perfectly sufficient to get the work done that we've needed to get done. But at certain points in time, you may need to do this a little differently. When you've scheduled your surgery, we do not give you a time to show up at outpatient registration when we send the orders. We want you to contact us 2 business days prior to your surgical date so that we can give you a show-up time. If you fail to do that, you're going to have some difficulty then getting in touch with us the morning of surgery, so please be mindful of this and contact us 2 days prior to that time. Now, what if you're at the hotel after surgery and you have an issue and you need to get in touch with me? Well, by that time I may be at home, I may be in bed, and so if you're at the hotel and you have an emergency, what you think is a real problem, call the front desk and they'll either send an ambulance to get you, or you can go back over to the hospital to the emergency room. Alternatively, you can call the emergency room. They have my cell number, they have my home number, they know how to get in touch with me, and they'll get in touch with me. Now, what happens when you go home? Well, when you go home, if you have what you think is a big-time emergency, then you need to either call 911 or go to the emergency room closest to you. They can try to get in touch with me, but generally they'll know what to do. There are not that many emergent situations that occur after the surgery. They're usually minor wound care kind of issues, so there are very few emergencies. Contacting me as a routine follow-up. How do you do that? Well, I want you to send me an email once a week, something short and sweet. Dear Doc, doing well, no problems, thanks, goodbye. That's sufficient. Now, on the other hand, you may have something that you think is a big deal. You can expound upon that in the email if you have to, or you can call 1-800-766-0304, talk to my staff, and they'll get in touch with me about it. Once again, if it's a big emergency, then you go to the emergency room. But I want you to send these weekly follow-ups until your wound is healed. Now, maybe within 2 or 3 weeks, everything looks good, you don't feel the need to do any more follow-ups, that's fine. Some people have incisions that heal a bit more slowly, and you may do that all 6 weeks. But give me the follow-up so that I know that you're doing okay.